Hello and welcome, everybody. Thank you so much for being here today. We have a range of topics to cover that are fun and exciting. I'm going to first tell you a little bit about who VetTriage is. We are not medical professionals, and we do not have medical applications. What we are is a provider of building blocks that go into those applications. So we're a global cloud communications leader. We provide applications and APIs, including AI, voice, video, SMS, RCS, messages, contact center tools, et cetera, et cetera. So why am I here to talk to you today? We have hundreds of customers in the healthcare space. So we think we have a unique vantage point where we're not doing one thing. We're seeing what all of you and our customers are doing. And I'm here to comment on reflections on what we're seeing. We've been in the telehealth space for some 8 years now. We are hidden away inside many of the applications you're familiar with, including Teladoc or DoxyMe or eClinicalWorks or Meditech or TheraRest or many others. So hundreds of customers gives us a sort of view of where are people focusing their time, what's important, what are the trends, where are things going? And that's what I want to share with you today. So if I share any good ideas, they're our customers' good ideas, but of course I'm fully capable of making my own mistakes, so they'll be mine. So I'm sharing what we've learned. I'm sharing the view that we see as we help businesses build the applications that you in the medical profession use, and some of you, I'm sure, are builders of your own applications in the space. And my goal is to give you an overview of where we see things going. Those of you who are practicing in some of these specific areas will obviously know a lot more detail. So I'd love to see not only questions in the Q&A, but feel free to comment on your experience and whether it's different from what we're seeing. Of course, ultimately, we're all serving patients, and patients are increasingly demanding with high expectations. And they're looking for technology. There's a sense in which all industries today compete with every other industry. We're all competing with Amazon. Everybody's wondering why your app isn't as good as Google Maps, or why isn't it as easy as using, Facebook or WhatsApp. We're in, as far as consumers and patients are concerned, there's all these technology things, and why can't you do that? If I can video my grandmother in Timbuktu, why can't your business do that? And of course, that is what telemedicine has been delivering, the ability to have these remote interactions wherever you are. So patients are looking for this technology, and communication and engagement is increasingly important to them. That's what they like or hate about the other vendors they work with. And bad digital experiences really turn them off. And what we know is that patients who are collaborative in how they work with us are much more likely to find value, are much more likely to value the healthcare organizations they work with, and correspondingly do the right things. So classic telehealth we're very familiar with, and classic in a positive sense here, in a classic Coke sense. It's been about one-on-one consultation where a doctor or a therapist is dealing with a patient. It allows the consultative moment with a doctor to be stretched anywhere. And as you know, this completely exploded during COVID. In March 2020, we saw a 10 to 20 times increase in the usage that all of our customers were having in connecting customers with doctors, and we remember that. And that created an environment where patients are now used to this. Certainly in the healthcare practice I use, it's a mixture now. I go in, I do physicals, I have a video visit about something that doesn't require that. And physicians expect to see this mix. They like the efficiencies of video, but they like to see people, and everything is a mix now. We're in a hybrid environment where the physical and the digital worlds need to work together. And we've been expanding the classic telehealth model with automation on the front end. Maybe we make it much easier to automate scheduling. Integration on the back end, particularly with your EHR systems and the data that's going to be presented to particularly the physicians. We have other participants. What was once seen as a one-on-one correspondence is now becoming a kind of a group experience. We've got interpreters perhaps, and why can't I bring in remote family members, particularly for an aging population where they need some assistance, maybe they need some specialized interpretation. Why can't we all be in this session, obviously with the right permissions and the right security, to make these sessions more of a group session than just an individual one-on-one consultation? And then we've continued to expand telehealth. Many of you are already working in the mental health space. We've seen a rise of group therapy examples where we're all in a group. Often you're physically seeing people like you see on the screen here. Some people exploring, what would it be like to be anonymous? Does that help in certain circumstances? And just hearing voices isn't very good, so maybe there should be avatars. Maybe there should be an expression of emotion there, even though people are anonymous. So, an area of exploration, but most group therapy is around people seeing each other as you would in the physical world. We see an increase in remote resources available for addiction recovery, which clearly is of immense importance in this country. And I'm going to come back and talk about the role of education. So these are all things we've already been doing in the telehealth space. And what I want to do is to sort of drill down on what else is going to happen next. Across all industries, we're seeing rising use of video and rising video expectations. As I said at the beginning, the patient as consumer is expecting their personal and business and therefore medical interactions, they're all kind of combined. They're all on my phone, they're all on my device. And we're seeing the mix of sort of AI interactions, how AI becomes a part of some of those interactions, increasing. A recent survey we did, available on our website, where we surveyed 7,000 consumers around the world, not our customers, just regular consumers, said they don't mind, they're quite comfortable. Most of them were very comfortable with AI interactions, providing they delivered value, providing they worked. So there's a space of opportunity here, building on video, and we tend to see it in terms of how do you define your patient journey? And this is one journey, and we're going to be talking about other journeys. Somebody who comes to you is, you want them to get access to their medical information, setting up appointments through an application. Now that we're all online, there's a tremendous security issue of people trying to break in and defraud your patients. I want to do scheduling. Do I need people to do scheduling, or is that a role that an AI bot could help? Increasingly, if it's going to be a video call, as you know, it's typically a requirement that there's a prep call from the nurse. Where's the nurse? If the nurse is not in the office, if the nurse is working at home, then you need phone calls between patients and nurses when none of the numbers are seen, or the numbers are the right numbers. So you need to control that. And then, of course, the moment of telehealth, or classic telehealth, is the telehealth visit. But then there's all kinds of follow-up. What happens next? How do we follow up? Is there information that flows through to the prescription side? Do I go home? Is there monitoring? And we're going to talk about these use cases. What kind of patient monitoring? What kind of remote care? What's the value of that? Is some of my treatment going to be online, going to be part of the application you're providing? And is there both positive and preventative education that would be valuable? And all of these are moments in the patient journey. And what we believe and what we see our leading customers doing is looking to see how can that become seamless? How can that become seamless so information and the interactions glue together? And how do they glue together not only online, but between the online worlds and the physical worlds? And you're familiar with many applications today. When I finally walk into the office, my mobile phone tells you that I've arrived and I'd set up the appointment on the phone. So these hybrid moments I would say the healthcare industry is doing this a lot better. If I walk into my bank, they have no idea who I am or that I've arrived. So a lot of investment has gone into smoothing those parts of the hybrid journey for our patients in the healthcare industry. And there's an opportunity for AI to be applied at various points in this journey, whether it's on the front end, which is more conversational. I've got bots that help automate things like schedules or rescheduling or other elements. We've got the moment of telehealth, which is going to be about optimization. We're going to talk a bit about that. And then all of these monitoring examples where I want to sort of see what's going on and decide how to apply analysis, processing information. So AI is, as you know, both a complex technology, but also some, a bit like glue. It goes all over the place and it can glue various different things together and help make them better, help make them come together and deliver value. So as we look at our customers, the customers we're working with who are building the healthcare applications that you as a practice would use or you are building yourselves, these are the kind of expanded healthcare use cases that I want to drill down. How do I optimize those patient sessions? What's going on in virtual nursing and perhaps monitoring and automation of that? What's going on in terms of at-home remote patient monitoring? What's going on in terms of education? Where are we in more live consultations leveraging the virtual technologies we're building? And what might that mean for some more advanced areas like surgery? A number of these topics have been around for a long time. What we're seeing is that they're now starting to come to fruition. I'm sure many of you on the practice side, are already experimenting with these, are already working out how they work and what to do about them. There's a range of topics in ATA. The ATA conference covered a range of these topics. And I did notice when we were all logging in, that there's a range of forums coming up in November on exactly these topics. And I would recommend you use the ATA resources and their forums and other materials to help drill down on these topics. I'm going to walk through these and look at them both in terms of why are we trying to do these things and what are the technology and architecture considerations. So obviously I'm coming from a how do you build these things perspective, and therefore I want to talk to you about how do you build these things. So the optimization of the session, the optimization of the face-to-face meeting with the doctor or therapist, the telehealth moment, you've seen across the industry, and Microsoft is certainly advertising this in full swing, the idea of the co-pilot, the idea of somebody who's assisting you, who's next to you, but it's an AI co-pilot that's going to help. Automated medical note scribing, building SOAP notes, allowing the doctor, as you see here, to focus on the patient and have some of that scribing work done for them, have it structured. There are a lot of our customers who are building applications like this. The example here is Quantum Health, who happens to be a Vonage customer. The goal here is increasing physician productivity, allowing them to focus on the patient, not typing. The experience shows this increases the number of patients seen. And as we look at building on this idea of optimization, how can we bring more timely advice and diagnostic suggestions to doctors? How can processing on the back end that says, when you next see Lawrence, you've really got to talk to him about, the effects of this medication or his blood pressure or whatever it is, because our analysis of the results shows that you should be doing that to accelerate the doctor thinking about that. Doctor obviously makes the decisions. They're already reviewing everything, but are they getting assistance? Are they getting co-pilots that help them? As we look at the technology considerations here, this obviously involves a lot of understanding and application of generative AI, predictive AI. And the good news is there's a lot of companies out there applying AI in the healthcare space. We provide some tools in some areas. but there's a tremendous amount of AI technology that companies are trying to apply. We're not the producers, as I said, of medical applications, but you will find a lot of vendors innovating in this area. So even if you don't have the AI experts on staff and you're not building it, you're clearly going to be evaluating, which of these products will give me advantages in my medical practice of adding this kind of session optimization. And it goes without saying that as we look at these, let's not just think about the doctor moment. Let's think about that expansion to sort of group settings, other participants, group therapy, and those examples, all of the examples I went through before should be considered in terms of how do I optimize them. And then it goes without saying, and this is going to be a theme throughout, that our focus here is not just that we're more efficient or we save money or that we speed things up. Can we measure the improvement on better patient outcomes? Is the process I'm designing here going to deliver patient outcomes? And you're going to see me beating a dead horse and constantly saying that, so I won't say it every time, but I like to think, and the customers we work with are very much driven by what is ultimately the end effect on the patient and on the patient's condition and how they succeed in their health journey. And here's a simple technology for optimizing a session, a telehealth session. Captions. Turns out if you talk to Gen Z and millennials, and I happen to have a couple kicking around, they use subtitles all over the place when they're they're used to it. It's part of how they absorb the information. And in fact, 28% of Americans seem to prefer, if you're watching something on the TV, you prefer to see captions as well. And 22% of the population speak a language other than English, where they might struggle with English and want to make sure that they're seeing this. So we see benefits of this being added in terms of ADA, in terms of privacy, in terms of, automated AI-driven captions is cost-effective, highly scalable, and increases that comprehension, which will improve outcomes. And so this is available technology that, I'm put the word here, simple technology, that is something that can be immediately considered. Some of the other choices, like providing diagnostic information, they're obviously more complicated. This is at the simple end of the spectrum in terms of augmenting the telehealth experiences that you're delivering. I'm sure many of you are already participating, doing studies, succeeding, working on the challenges with virtual nursing. Nursing where, particularly within a hospital or clinical setting, there's somebody on the wall, right? There's somebody who can assist the patient, and the virtual nurse is able to, move around the building by appearing in different places. There's a lot of obvious areas, like, when the patient first arrives and it's admission, and there's a whole lot of explanation to do when they're being discharged. But in the middle, there's explanation of certain procedures and so forth. This is something that I think that studies are showing improves outcomes. It absolutely allows you to get access to a wider pool of nurse resources, often skilled resources that may have retired or moved to part-time work, who can then provide mentoring to perhaps newer nursing who might be actually in the room. If we're going to put this kind of infrastructure in a room, then that allows physicians to be engaged quickly when needed. It also allows us to start to look at continuous monitoring. Why can't the system watch what you're doing? Why can't I, implement certain automated anti-fall mechanisms or alerts, and generally sort of monitor and watch what's going on? There's a whole bunch of HCAP elements that I want to sort of understand. Did this happen? Didn't this happen? How often did we visit? That surround the that sort of survey and the score measurements, potentially. Can we automate it? How many times did we wash our hands, right? And so forth. As we look at the technology considerations for virtual nursing, and I know some of you are already, you are the builders of these systems. How you get the in-room device properly integrated is obviously a key challenge. I should say here, I've chosen random photographs. Some of them may be our customers, some of them will not be. But here's a room with 2 TVs. Just simple, boring stuff. It's very difficult to get the TV to do your work when you're trying to appear in the room and the patient has completely wrecked the TV by putting it in some state. We need a new generation of devices that are capable of being badly used by the patient, but then available to you when you want them. So the off-the-shelf TV is no longer doing it. And that's just taking one simple example, of a regular device. How do I bring all these TVs, cameras together? As we start to do the monitoring, particularly real-time monitoring, then I suddenly are going to have network challenges. So work that we do with our customers is to start to look at what's the architecture, where's all the video going. Whoever designed your network probably didn't think that you were going to have a live video feed from every room going somewhere. And particularly if your virtual nursing is off-site, they probably didn't think it was all going to travel through your internet connection. So thinking about the network is going to be particularly important as we start to do that as part of your sort of technology view. We've got to think about how much AI processing we're going to do and where are we going to do it. The cloud is expensive. How much can I get done in the device? Are there ways of getting enough done in the device? And then once again, I'm harping on here that, if I'm putting all this technology in, I don't just want the virtual nurse and the physical nurse. How about the doctor? How about an interpreter? How about members of the family who are part of a consultation who are remote and can't be there in the room? How do I make that a better and more productive overall experience? Here's a picture of me. The kind of underlying technology here is how much can I get done on the device to do client-side video processing? Can I recognize who's in the room? Can I recognize movement? Can I recognize people getting out of bed? Can I recognize what's happening? And how much of that can I get done quickly, given the power of the devices that we have these days? How do I react to what's in view? How do I look at motion and anomaly? And there are whole ranges of libraries, often open libraries, that people are building into their applications. And if you're an application builder, this is a whole area of technology that I know you're investing in. It needs to be combined with audio processing. I want to hear the crashes and bangs, and I want to distinguish, which ones are important and which ones are not important. And can I capture, information from the patient and how they're looking? Is there a way of perhaps interpreting that? Can I see, how they are in the bed or whatever is going on for certain sorts of patients? So there's a whole area here of AI-driven video processing that somebody's got to invest in. And as I suggested, it's going to be the application builders, a lot of these emerging companies, some of you here, who are going to be investing in that, and the practitioners are going to be looking at, okay, which of this stuff works? How powerful is it? What can it do for me? But these are absolutely areas we see businesses investing in. And then as we rotate from the hospital to at home, there's a tremendous amount of work, as you know, going on in remote patient monitoring. Once again, to deliver better outcomes and faster recoveries for people we've sent home. And the experience is that these systems increase patient confidence, increase engagement. I had surgery last year, and all of you know when you finally arrive home, you feel desperately alone, wondering what you're supposed to do and what the next step is. Can you increase confidence, engagement, and me doing the right things when I'm discharged? And obviously then lower the returns, lower the physical visits, and make it a better recovery process. And it doesn't just have to be about folks leaving hospital. Prenatal care is an area where remote patient monitoring, understanding things is important. Chronic conditions is obviously a huge investment area where I want to be able to monitor. And increasingly, we're seeing even mental health has opportunities for this sort of continuous monitoring and checking in, given the sort of mental health challenges we have these days. A lot of the early work here has been driven by home devices. Number of companies building systems, devices that go in the home where you measure various things and there's a real-time data feed that's going back and being looked at. What we're hoping to see is a greater combination with video telehealth. If I've got the data feed, why is it not properly connected into the interaction with the doctor, which is kind of seen here, although it's not clear in the picture what's connecting things together. How do I connect things together to do that? And once again, if I'm a patient who's just got home and my daughter or son is on the other coast, can they be part of that, right? I'm a strong believer that just having the doctor is not enough, that there's plenty of opportunity for family augmentation of the healthcare process. And then surrounding this, there's a lot of communication. Where do I get my messages? How do I get told to turn up? How do I know that I should be doing these things? And we're increasingly used to getting, SMS or now going forward, RCS messages on our phone that tell us things, that take us to the app, that take us to what we should be doing. There's an opportunity here for AI-powered dialogues. Some of my medical condition can be gotten by putting something on my finger or wrapping it around my arm, but a lot of things maybe it needs questions. Can that be automated? Can that data be collected and then put in? Can it help gather the status? And then if I have an issue, then how do I get hold of my care team? And how do I get hold of the right members of the care team? I'm a believer that it's utterly crazy that we still give people phone numbers. Why should I be digging around, trying to find the phone number, calling the care team, ending up at some front desk somewhere who says, who are you? What do you want? And I'm busy trying to, the in-home monitoring system you just built knows all of that. Why isn't there just a button on it that says, call the care team, tell them exactly who I am, tell them why I'm calling, and connect me to the right people in the care team so that, even if I'm waiting in queue, at least I got to the right place. And particularly for a range of patients, more confused patients, making it easy for them to get hold of the resources they want, given that you've already invested in putting the application there, is important. And obviously the whole area of data and analytics that you're getting from all of these systems about what happened, not just the telemetry from all the devices, but also how many times did they interact, who were they visited, when were they visited, et cetera, virtually or perhaps sometimes physically. All of that becomes then a sort of a data management challenge, and a challenge, once again, that the folks who are building these applications we see investing in. And related to that is sort of education. How do I get patients to understand things and understand what they need to do? And I put the top picture in here as a joke, right? The idea that we get everybody together in a classroom is no longer ever going to happen, right? It's going to look much more like the second picture, where it's an at-home experience that's got to be integrated into the systems you're using. As I said, I had surgery last year, and I'm fortunate that the hospital I went to had a whole after-surgery process, that there were people there, that there were resources there, and I got training there. I learned more about vegetables than I ever knew. So I'm fortunate. As we look around the country, as we look into rural and remote patients, education is sorely missing, as you all well know. How do I make that a part of these applications? So what we're seeing and what we hope for is that it needs to be part of your whole app and at-home experience. And nobody's going to sit through a lecture. It has to be sort of bite-sized, on-demand pieces. There's an opportunity, once again, for AI-powered Q&A or quizzes or gamification, as it's called, where I make it fun for you to discuss where you are in your health journey. It can be combined with the other home capabilities, combined with telehealth, so that these things integrate together. And I think it is a design challenge. We often think about education at the end as an afterthought, whereas it needs to be a priority within our applications and within the patient experiences we deliver. And that means the right skills and staffing, right? Do you have training experts who understand, how to build small bite-sized pieces of content that fit together rationally as part of your team? But, don't make it an afterthought, make it a priority, and ensure we have the skills and staffing that sees training as part of the overall experience. So that's what we hope for. And then moving on to where the connection is between experienced people on both ends, where there's a live medical consultation happening, where we're able to bring the right medical skills to help, especially where we have a rural, remote, international clinic with a shortage of doctors, or a remote clinic that may only have nursing staff available. How do I get the consultations to work? So I've got patient to local resource, nurse or doctor, to further out resources. And some of you may recognize these pictures. We are privileged to have Intuitive Surgical as a customer. And they and many others are building amazing medical technology. And our role is, well, then how does that connect to other people? Because we're the communications technology provider. How do I get somebody in the room? And maybe that, can be part of the actual procedures, surgery, early days on that to have consultation. We do see a lot of training use. I get visibility in what's going on at the point of care. Medical students, interns, residents, is there a way of capturing this? Is there a way of participating, making it part of the training experience for them? And the challenge here is, how do I bring video to the point of delivery? And as you know, medical instruments like the ones we've been talking increasingly have cameras in order to drive a robotic surgical instrument. So you have the opportunity to sort of work out, well, where's that data going to go? But also, where am I examining somebody? Where is the examination happening? And is there a way of connecting a remote resource in there? As these applications become more sort of mission critical, then network connectivity is key. If I'm having a doctor-patient telehealth session and their internet blows up, well, they'll have to reschedule. If I'm having an expert come in and help me with a complicated procedure, it absolutely better not blow up because otherwise I'm going to continue without that resource. So quality of service is going to be key. Now, Vonage, we happen to be part of Ericsson, one of the leading providers of 5G technology in the world. So we're very interested in how we can, with the next generation of technology, provide ways of ensuring quality of service when needed at the right point. And many of you possibly see 5G as something to do with my mobile phone, but it really is a way of delivering the right networking anywhere that you need it. The growth of, I'm personally using 5G as a way of getting internet connectivity into buildings. And if I could get that with guarantees, with quality, with failover, I may want to augment my network. Maybe my existing hospital network's not up to, can I guarantee it's up 24/7 for the hours of the procedure? Do I need to augment it with other mechanisms? So we see these kind of networking decisions are going to be part of the building of these applications. If they're going to move from being, it's okay if it doesn't happen, to it's absolutely mission critical and it's got to stay up, then networking will become key. And what we're doing here is we're integrating physician, consultant, patient journeys. So I talked earlier on about the patient journey. I've now got that journey interweaved with the physician, and then I've got a consultant, and I'm back to where I've really got to make sure that that journey is automated and these people come together at the right moments, it's going to put much more emphasis on the scheduling and the workflow and the process. Help Lightning is an example customer of ours, and I'm using them here to talk about the role of mixed reality, where I'm able to both see things and also provide visual information. They currently deploy a lot of applications for medical equipment servicing. So once again, less mission critical, but there's absolutely the future potential of mixed reality for broader medical patient care. So that you're actually getting this sort of mixed reality experience when you get the consultation from the remote expert, that they're able to sort of not only talk to you, but show you. So this is an example of AR and mixed R, mixed reality technology, being relevant in the next generation of remote consultative care. Throughout this, we've been talking about the role of AI in a variety of different ways. And what I want to go through here is just some of the considerations about how to think about AI. The first is that we should distinguish the role of AI in patient communications, the external communications, and the role of AI as a co-pilot, as an assistant that's helping me. They may use similar technologies, but these are very different use cases. If I'm engaging the patient, they have an expectation that they're being engaged on their terms. And we've got to make sure that the channels of communication, if the patient's calling in, if the patient's sending me a message, if the patient's inside the application, or if it's within my healthcare or my at-home application, and the AI capabilities and the back-end systems and the data, this is a complex system architecture putting things together. So the point I'm making is, it's not just about the AI technology itself, it's about how it fits together into an architecture. There's a lot of news, and if you end up on the bad news side of this, that's not good, about security and privacy. Really knowing where does the data go, really making sure that it's not misused. Really, these are questions that the patient will have. So when AI comes in, their questions about, well, what's the privacy of this data? What's the privacy of this moment? Where's it going? And some of you, we're going to see lawsuits, and we're going to see people worried about this in various spaces. So understanding and making sure that you or your providers are really putting emphasis on security and privacy. A lot of this is going to be real time. So the real-time connectivity, the underlying network. A lot of these systems need to incrementally learn. They're not one and done. So how I build them so that they're learning and I'm monitoring what they've learned and I'm monitoring where they ended up is important. And if I'm communicating with patients, here's a fun thing. I've got to think about what is my brand voice, right? If the patient is calling the hospital and the hospital talks to them, what should they sound like, right? What should the style be? All the things that you would worry about in other industries, and perhaps the entertainment industry, you've got to sort of partially worry about even within the healthcare industry. People calling in about medical procedures don't want a flippant voice. On the other hand, if all your voices are really desperately serious, then that's depressing. So what is the right brand voice for the right moment? So these are things that we historically never had to think about, and we need to. And for those of you who are developing these applications, obviously, whole range of tools, you're going to be looking for which are the tools that help me, which are the models, how do I understand the sort of space of large language models, and where do I get the expertise? And you'll be looking for expertise that you build yourself, and you'll be looking for AI expertise from your vendors, the providers of applications, and the provider of applications may look to a variety of vendors, including Vonage, to get assistance in thinking through AI. So I think AI is a journey that we're on. I think it's a complex journey. I think it has a lot of factors, but these are some of the things to consider. This particular presentation hasn't been on AI itself, so that I've covered those kind of briefly. So with that, I want to give you some takeaways, and I want to ask you to talk about, I want to ask you to click on the Q&A button and ask some questions. And, some of the questions are, will the recording be available? Can it be shared? And the answer is absolutely yes. You're going to find it shortly after it's packaged up on the ATA website. And you can contact us at Vonage and there'll be a link with the recording if you want the slides and presentation. And we're certainly happy to talk to you, particularly if you're in the process of building applications. So please enter some questions. The takeaways that I want to give you is that, classic telehealth, I believe, is a proven success, right? I think we saved the planet in 2020 and made things work. We deal with a lot of industries. The healthcare industry was better prepared than any other industry we deal with. And that was because of the investment in telehealth. Now, it had a scaling problem. It suddenly had to be 10 to 20 times as big, and you needed systems that were capable of supporting that. But the thinking that had gone into the telehealth industry for the decade before really prepared the industry for that moment. And that's what we need to be doing as we go forward. Now is the time to build on this. Now is the time to expand the use cases and look at how do we lower our costs? How do we deal with the challenges of care? How do we deal with the staffing, the skill challenges, the remoteness, the state of rural healthcare? How do we marshal technologies to help us with this? And in doing so, there can be a mix of different things. There's going to be patient expectations. There's going to be the productivity and the benefits that we get, and then how do I measure that, and can I measure it against the outcomes? We've talked in an interweaved way across this presentation about the role of AI in improving this experience or helping with this part of the patient journey. It weaves throughout things. So it's a key technology to many of the decisions you're making in building and deploying the kind of applications that we've talked about here. But it is a challenging technology and will take expertise and work to apply well. The good news is, as I said, we work with hundreds of customers building applications around the world in healthcare and many other industries. And our observation is there's plenty of innovation going on. There's plenty of emerging and also established companies in the healthcare space with great ideas, expanding their platforms, startups building new things that may get absorbed into those platforms, so that better and better tools in all the areas we've talked about are available to you. So this is a moment, I think, to go out and explore and find the solutions that make sense for you. And what I hope to have covered here is what are the kind of use cases that we, as a provider of some of the components, see the industry start building, deploying, testing, and making effective. And I think the expansion in areas like virtual nursing and remote patient monitoring and at-home care is going to be a significant area of expansion as we look at the next couple of years ahead. And some of you are already deploying and working on these systems. So with that, I want to thank you for your time today. This information will be available, and I'd like to once again ask you if you have questions. And I have a question here from John, which says, can you talk a little more about the network challenges of virtual nursing? So the first thing to point out there is that in a virtual nursing scenario where the nurse is visiting rooms and helping and is responding to an alert, that is not adding a lot of issues, right? Because you've got a finite number of nurses, and they're only in so many rooms at once, and so the architecture of that system is more constrained. Where it starts to get intense is where you want to do continuous monitoring, where you want to see every room in your hospital, which means I need live video and other information streaming from every room in the hospital across your existing network. And it's typically not ready for that unless you unless you're designed for that. Some of the design considerations will be, as I said before, what can I do on the client? What can I do on the server? If I'm going to do sort of server-based analysis of whether what on earth the patient is doing, then I've got to move high-resolution images through my network out of my building and up into the cloud, and that's going to be intense if I've got 500 beds, for example. If I can get much more done on the client, then while I'm monitoring, I can see a much lower resolution view of the room, but the room inside the room knows what's going on and is capable of alerting and saying, this incident just happened in this room. Now I suddenly want the high-res view, and I want somebody looking at it, but all the activity happened in the device. So part of the architecture is designing what happens in the device, what happens in the cloud, and what kind of network. Like everything else, we all need better networks. Carlos asked, could you comment on interoperability? I think I'm going to give you the bad news answer, Carlos, which is there's a level from a technology level where the technologies interoperate, right? We're all using standard networks. We're all using standard video protocols. We're all using standard ways of doing things. But as you start to build these things into applications, it's typically not the case that you can buy applications from 3 different vendors and they magically plug together. So the points of interoperability tend to be where the data goes. So if you have these peripheral systems and they're all integrated within a common EHR, then the EHR is where the data goes. The EHR may be where the recording goes, or other data, or the AI analysis goes. And so you've got sort of data interoperability. But we're not seeing that the different apps from different vendors magically talk to each other, and there really aren't any standards. There are not many standards of how they should. I remember there was a period of a lot of sort of interoperability standards between applications back in, the manufacturing apps, but I haven't seen that in the healthcare space. Maybe somebody can correct me here. So I tend to think the interoperability is at a low level, and then it's at the where's my data? A bit like in a regular business, what's my CRM? Where's the data going? And the CRM, obviously, for these systems is the EHR. Suha asks, what do you think are the limitations for primary care telehealth visits and what future development it needs? So I commented on some of those things earlier on, right, which is, I'll talk about some future things and then come back to limitations. So in terms of the future, what we want to see is a look at much more of this sort of group interactivity. Who else should be participating, and what else should be in the patient journey? So have you considered what happens first? Have you considered what happens afterwards? Not just the moment of primary telehealth. And have you considered who else should be participating? So we see the immediate future is about those things. And then I suggested the longer term future is about optimizing that experience, like with medical scribing, like with assisted diagnosis, like with other AI tools that are part of the doctor or therapist sort of armory when they're using their side of the application. I mean, obviously for telehealth, one of the limitations is you can't physically see the patient, you can't physically examine them. So there's all kinds of needs where you need to go visit. As we look at this sort of remote monitoring, then we start to see a lot of things that would have required a visit that may be remote monitored, right? If I have blood pressure issues or if I have breathing issues, then I can be given tools that will measure these. The advent of wearables, right, is going to deliver a lot of sort of, watches and Apple Watches and Fitbits or whatever, gives a level of information, not great levels of information. So that's why there are sort of medical devices that can be added to this, but start to give a sort of data stream that means, yes, I still need to physically examine you every now and then, but I can get an idea of what's happening in real time, and I can get you to participate in that care. But I think, all of these visits are going to be hybrid. I mean, you have to design for a hybrid environment. Physical visits to the doctor are not going away. And so the question is, what kinds of interactions are video interactions? What kind of interactions are physical interactions? What kind of interactions could I be doing some remote monitoring to give me data before I decide to have a visit? And is it worth it, right? Because I'm putting equipment in the hands of the patient. Is that worth it? Or can I make use of consumer equipment that won't be giving me the same depth of information and the same accuracy, like wearables, but gives me something, or other tests, or can it be done through a conversation, where the AI talks to me and asks some questions and then goes away, and that's the answer for the day. So I don't know if I answered your question, Suhab. Please ask again if I didn't. And we're about to come to the end, so I want to give folks an opportunity to ask a final question, and please pop it in the Q&A box. Otherwise, what I'd like to say is thank you all so much for being here. I'm truly excited by the expansion and future of digital healthcare as it grows out from our very successful experience of telehealth and starts to expand the digital reach of how we reach patients, how we reach patients wherever they are, how we reach patients of different sorts in different ways for different incidents, and how we make the digital world and the physical world, interoperate in a more effective way. So with that, thank you so much. Please make use of the ATA website. Please feel free to come to Vonage.com. And if you are out there building applications, we're in the business of providing you tools to help you build successful telehealth and other healthcare applications with the APIs, communication tools you need, and you'll find more on our website. Thank you for attending today.